Hi everyone, I am Dr. Sagar Basu, Senior Consultant Cataract and Refractive Surgery at the Eye Foundation, Cochin. Cataract is the normal opacification or cloudiness of the normal lens which is present inside the eye since birth. So after 40 years of age, this lens becomes opacified, and as a result of it, the light does not enter the eye, because of which patient feels blurriness of the vision and the visual quality comes down. So it is the right time to see the doctor for a cataract checkup. Cataract surgery is not a major operation. It is a daycare procedure. So patient generally walks in, we finish the surgery, and patient walks out of the hospital pain-free within 2 hours of the surgery. So it is a daycare procedure. It is not a major operation. Here in Eye Foundation, we have all the advanced methods of cataract surgery, starting from micro-incision cataract surgery and cataract surgery, which are depending upon laser platforms. In micro-incision cataract surgery, we do cataract surgery with 2.8 and 2.2 mm incisions, which are very minute incisions and which heals up very faster. Secondly, we use laser platforms with femtosecond laser so as to reduce the energy time which is used during the cataract surgery. So patient walks have a very good crystal clear vision after the cataract surgery. During cataract surgery, we remove the cataractous lens from inside the eye and we put an artificial lens inside the eye so that all the vision of the patient becomes clear after cataract surgery. Here in Eye Foundation, Cochin, we are implanting multiple types of lenses for providing comfort to the patients after the cataract surgery. First is a monofocal option in which the patient have a very good, completely glass-free vision for far, but for the near he has to use glasses. Second option is enhanced monofocals, which are generally given for computer users for giving an excellent clarity for intermediate vision and far vision, but for near he has to use glasses. And the last and the best option is the multifocal option, in which we provide completely glass-free life to the patient, giving good vision for far, intermediate and near. Normally in Eye Foundation, we take 20 minutes for cataract surgery, which is a completely painless, stitchless and bloodless surgery. So patient can go back home within 20 minutes after the surgery. Here at Eye Foundation, we do maximum surgeries under topical anesthesia. Topical anesthesia means we use only eye drops for doing complete cataract surgery. So we are only using topical anesthesia for all the cataract surgeries. We don't use injections. Aftercare after cataract surgery is that the patient should not be allowed to take head bath for 7 days so that we can prevent infections. And secondly, he has to put the drops as advised by the hospital depending upon the post-operative schedule, and he should avoid strenuous activities during the post-operative care. No, cataract will not go back. Once the cataract surgery is done, then it will not grow back. Yes, the need of the glasses can be completely avoided after putting in multifocal lens, which gives good, excellent, far, intermediate and near vision. Eye Foundation Cochin is empaneled with all the insurance here in Cochin, so you can come here and take the avail the facility by directly contacting the insurance desk. Here at Eye Foundation Cochin, we have the most advanced facility for cataract surgery. And we are all empaneled with insurance. So please come and take the facility. Any patient who is having symptoms like blurry vision, diminution of vision, or he is having difficulty in doing day-to-day activities should definitely come and consult your ophthalmologist for cataract. Thank you so much.